welcome to the Rotary Times, a public service program presented by the Rotary District 7610, Virginia. For this program is made possible by Rotary District 7610. To my audience, our programs are taped ordinarily, and today we want you to know that we are taping from our homes and practicing all of the models that we are told to practice about social distancing. But on our program today, we're going to talk with a community leader from the medical profession. Ordinarily, we do talk to community leaders and discuss international and how its programs impact the local, national community. I am your host, Dr. Debra Jackson, for the Rotary Club of McLean, Virginia. On our program today, we're delighted to have Dr. Valdo, board certified emergency room physician in the Washington metro area. Welcome, Dr. Crotter.
Hi, how are you?
I'm great. Hey, look, I understand that you are affectionately known in the area as Dr. V. May I refer to you today as Dr. V?
Absolutely, absolutely.
All right. Perfect, perfect. But before we even start the program and get to talking to you, I just want to say on behalf of the family of Rotary, let me thank you for taking the time, I know out of a busy schedule. As a physician right now on the front lines, I know this is a hectic time and it's overwhelming. So we want to thank you for in front of our viewing audience, from the many thousands of Rotarians in District 76 for all you're doing on the front lines. Okay? This crisis we know has upended life as we know it around the world. And it's called COVID-19. So today we're going to learn even more about this virus that people are talking about and how it impacts communities. And those in communities, locally, national, and we know throughout the world. And you're going to help us with that. You're going to help us also figure out how we can keep our families, ourselves, our communities safe. So let's get started. But before we get started with the harsh realities of what we're dealing with every day, I want to find out a little bit more about Dr. V. I want you to tell us a little bit insights into your background, your life before medicine, your education, where you're from. Help us learn more about you.
Yeah, so I'm from a very large family that's primarily from Memphis, Tennessee, and Batesville, Mississippi. I grew up in upstate New York, and I was always really admired my pediatrician. You know, I had a pediatrician that was a female pediatrician, and to me, it was just always amazing that you could leave there, take whatever she gave you, and feel so much better. And in high school, I started rotating with her on her rounds in the hospital, and then I decided to go on into medicine. I went to undergraduate at Cornell University, and I majored in engineering. And then from there, I went to University of Cincinnati to medical school. And I did my residency in emergency medicine in Detroit, Michigan at Beaumont Hospital. I got involved there in one of the White House projects to increase access to care. As a result of that, I decided to go back and get my MBA because I thought it was very important to actually merge healthcare skills with business skills. And we're seeing that right now in COVID-19, where it's a balance between healthcare and business. So I went and got my MBA from Wharton, and I've sort of been practicing clinically and also doing some business consulting for 30 years now.
Yeah, wonderful, wonderful career. If you had to give a tidbit of information, quick synopsis to someone that might be interested in the medical profession, what would you tell them?
I would tell them that, this is my fourth pandemic. I've also worked on a Hurricane 5 natural disaster that went through St. Croix, Hurricane Irma, and also a mass shooting. And there's a lot that you see in emergency medicine clinically, but there's also a lot that you can do in the community to actually make a difference. And so, I've been very happy with my professional walk in life. You know what I mean? It has served me well. I get up every morning feeling like I'm making the donuts.
There you go. There you go. Hey, look, like Rotary, we're all inspired by community service. What's one project that you can think of that inspired you or was personally to you touched your heart?
You know, I actually did a project where I went to Zimbabwe. And they have no emergency medicine in Zimbabwe. So there's no 911, there's no ambulances. You just, even the police officers don't have police cars. So if you're sick, you kind of flag somebody down and hope they'll take you to wherever you need to go. And so, yeah, that was a particularly interesting and motivating experience for myself. I got to interact as well with some medical students on a complicated tuberculosis case. And so, yeah, that was particularly, and I got to do it with a family member of mine from Mississippi. So we got to do the mission together with families. So it was great all around. Yeah.
Again, it sounds just like the Rotary experience that we all have within Rotary. So I'm glad to hear you say that. Plus, if truth be told to our viewing audience, we are both sorority sisters. We just found out a little bit ago.
That's
and
right.
One of the things that we share is that experience around giving back. So now let's transition to the conversation of COVID-19. We hear the phrase quite often, global pandemic.
Right.
Help us understand what that phrase means, and then how does this COVID-19 fit into that?
Yeah, so a global pandemic is any infection that actually spreads across multiple countries. So an epidemic is something that's local. A pandemic is something that actually spreads across the world. And it's always an infection. It has to be something that's contagious. And it also is something that we don't have immunity to. So examples would be polio, smallpox, tuberculosis, malaria, yellow fever, and now COVID-19. And then those diseases are then given a name or identified through the World Health Organization.
I got you. So you're continue to see patients, I know, and they are infected. What are some of the symptoms then of COVID-19 that you're seeing? Because I understand they change from day to day almost.
Yeah, so it's very interesting. I think that most people think that it's respiratory symptoms only, but the earliest sign that you get of having the infection can actually be a loss of taste, a loss of smell, or a loss of appetite as a result of losing taste or smell. There are other things that you can get. You can get GI symptoms. It can cause nausea, vomiting, diarrhea. We've seen people also get what they call COVID toes, which is kind of like a reddish, bluish coloring of their toes, almost looks like it's frostbitten or blistery.
Wow.
And then the respiratory symptoms that you hear of, the shortness of breath or the chest pain, or some people will describe a fire in their chest. Fever is very common, a dry cough. I think the other thing that's very important is that there is a lot of asymptomatic cases of COVID-19 where people have no symptoms at all and actually contract the disease and spread it.
That's serious stuff.
Yeah.
I hear age ranges spoken about a lot. How does that factor into this?
Yeah, so the age, there's a set of risk factors, and those risk factors make it more likely that you'll either wind up on a ventilator in the ICU or actually die from the disease. So those risk factors are anybody who's born on or before 1955, anyone who has lung disease or COPD, emphysema, asthma, anyone with heart disease, also anyone with severe obesity. And a lot of people don't know obesity is a risk factor at any age, which is a BMI over 40. So that would be somebody who's like 5'2", over 220, somebody who's 5'10", over 280, somebody who's 6 foot, over 300. And then anybody with a weakened immune system. They talk about cancer and people who are on chemotherapy, but it's also HIV, lupus, sarcoid, rheumatoid arthritis, all of the autoimmune diseases, MS, any of the autoimmune diseases that decrease transplant patients. All of those patients are at increased risk for not doing well with the disease, requiring hospitalization or ventilation.
I heard something recently, and actually in the last couple of days, about the children. Is some of that, sometimes we got to be able to filter through the noise and figure out what's fact and what isn't. Kids in this COVID-19, Is that a factor that we should even be worried about? Yes, I think we should be worried about it just in
Yeah,
general, no matter what age. But
right.
what about kids? Because many of us are educators and we're involved and connected to schools.
Yeah. So we are seeing, and we don't know why, but we're seeing more severe cases in the United States in young people. So
Mm,
when you look at the hospitalizations in the United States, 40% of them are 20 to 54 years old.
mm,
We've also had very young deaths. And we're not actually sure if this is a strain of the virus that has maybe mutated in some way. The COVID toes is something that you particularly see in young children. It's important that parents recognize it and don't bring the kid around other people. What's going on with his toes? Because it is very contagious. You're also seeing an inflammatory reaction in kids that is almost like a disease that they call Kawasaki's, which is where they're actually getting inflammation of their tongue, their mouth, their vasculature, and that can be a very dangerous condition. So we're seeing kids that are getting very sick.
mm. That's great. So we just need to be vigilant, I guess, as parents or anyone that's operating in general. When you see something that's not normal, there's that old quote: "If you see something, say something," and this would
Right.
apply in this case too. If you see it, say something. At least to ask the question. This is the time
Absolutely.
to ask questions.
Absolutely.
What about other factors? We hear about one group of people being more vulnerable than another. Talk to us about that.
Yeah. Yeah, so a couple of things. Men are more likely to get the disease. They're almost 30% more likely to get the disease. And they're about 65% more likely to die from the disease.
Wow.
And we don't actually know why. I know that there's been a lot around facial hair. We've recommended in the hospital setting that employees actually eliminate their facial hair because the virus does sort of accumulate in hair, particularly something that's near your mouth or nose, and that they may be getting a larger viral load as a result of that.
Mm,
But yeah, so we are seeing that. We're also seeing African Americans and Hispanics and Native Americans are also a low socioeconomic status. Communities are not doing as well with this particular disease. And I think that a lot of that is lack of access, sometimes, lack of education, and also, usually there's all sorts of chronic diseases that maybe haven't been managed the way they should be in those environments.
mm. So this disease has exposed a lot of inequities. Sounds like in our society in general, that probably on the other side of this, we really are going to have to address and pay attention to.
Well, it's interesting because, the employment numbers came out today.
Mhm.
And it showed that the unemployment rate, I think, was right around 16 or 17%, and they're expecting it to go up into the 20s. And, I always say in an environment like this, how do you have your health insurance tied to your job?
Mhm.
Now you just lost your job. We're looking at 30 million people that have filed for unemployment and lost their job. How long are they going to be able to pay for COBRA?
Yeah,
Right.
yeah,
And
yeah.
so we have to transition our healthcare system to a system where your health insurance is guaranteed and not tied to a particular job.
That's good food for thought as we think through next steps, going forward.
Right.
Because we can't think going backwards at this point.
Right. Right.
We must think about going forward because
Right.
we have been changed. I'd like to tell changed forever.
Right.
Um,
It really has
Talk
been.
about too. When I think about what you do, and again,
Mm,
I'm just so happy that you're here for us today, not just with us,
mm,
but for us today. Um, I wonder about what it is we're going to be able to do it moving forward from a psychological impact.
mm.
I know this must be rest hard, hard on your mind every day when you get up to go to work. I have a niece who was a nurse, and I have a very dear friend who's a nurse, and I have a very dear friend in New York who's a doctor, and
Right.
I hear their conversations, and I always wonder when they're talking to me, how you doing? That's
Right.
always my first
Right.
question to them. How you
Right.
doing? Because I know This has to be draining. Tell us, again, you are on the front line. You're walking into
Mhm.
that hospital. You're seeing kids. You're seeing adults. You're just seeing so many people, and you don't know which way this is going. You hope for the best always. Uh,
Right,
I see nurses having all kinds of celebrations as people
right,
in the hospital, and we need those celebrations. We
right,
need them just to get us out the house sometimes.
right, 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 exactly.
Talk about how you're feeling right now as well.
Well, it's interesting. For me, in doing my Tuesdays and Thursdays webinars, I had a 9-year-old girl call in for the first time on the webinar this week. And she said, Dr. V, I'm scared. And I was talking to her, and a very young voice,
Mhm.
and she was scared for her family. She was scared for her friends at school, if she'd ever see them again. And I actually, I think it's the kids that I'm actually most it's the kids that I'm most concerned about,
Mhm.
because this is life altering. This is life altering for them, and some of them may be at a maturity level where they don't necessarily have the skills to cope with it. Do you know what I mean? I think for us in the emergency department and for the nursing staff, we've sort of, especially those of us who've been around for a long time, a long time,
Mhm.
this isn't, as they say, this isn't our first rodeo. So we're kind of, we've been through, HIV when that kind of hit us. We've been through, like I said, mass shootings and hurricanes. So we've kind of been through this before. And so I think, and sometimes I know for myself, I look forward to going to work
Yeah.
because I get to go out and socialize and interface with other people. So, I think that it probably going to work helps me really but it is stressful when you get there. I think that it was really scary for a little while when we weren't social distancing,
Mhm.
and it looked like we were possibly going to be overwhelmed. I will say, the best thing that people can do is continue this social distancing so the hospital system is not overwhelmed. The last thing we want is people coming in and we don't have enough staff, we don't have enough beds, we don't have enough PPE, we don't have enough ventilators. That's when I think that it would really cause, significant strain and stress for us.
Gotcha. Gotcha. Um, you something. Your Tuesday webinar had an opportunity to join one of those, and I think our audience would benefit if they'd like to visit your website. What's your website for finding out information about when those air or when they're online for people?
Yeah, so it's askdrv.us. So that's askdrv.us. And
Okay.
on there's a link that you can just click, and it's a free registration. You just register and get on any Tuesday or Thursday night at 8 o'clock.
And ask Dr. V any questions
That's
you
right.
might have.
That's right.
You
If I'm working in the ER, I tell people there will be a recording, but that's not usually. Usually
yeah,
I'm there.
okay. I got you. Hey, look, you talked to me earlier about wanting to just share something about a plan that families and individuals should
Mhm.
have a plan. What do
Yeah.
you mean when you say rather that they should have a plan?
Yeah, so I think it's really important because this can be scary, and things when people get when they get filled with fear, they actually get paralyzed and they kind of freeze. And so what I want to actually really make sure is that people think out, what are the things that I'm doing in my life where I might actually get exposed to COVID-19? Where am I coming in contact with surfaces, maybe where other people have been? And what sort of things can I do? Do I want to put disinfectant in my car? Do I want to have wipes in my car? Maybe I'm going to have my groceries delivered. You want to maybe be more careful if you go pump your own gas. Certain things. This virus lives on metal and non-porous surfaces for 4 to 5 days.
Mm.
So it's very, very important that you look at where am I coming in contact with these types of surfaces? Do I have gloves? And just begin to look and create a plan for yourself. And then businesses should also create a plan for themselves and their workers.
Okay, and we're hearing a lot about that as every state is looking at how they will open. And then
Hmm.
there's discrepancy from state to state, but that's
Right.
normal that you would have that. But everyone uh, should be looking at their own personal homes and
Yeah.
families as well as transitioning back out into the real world. So
Right.
let's remember, we're going to have a household plan and we're going to have the workplace plan. Love it.
Exactly. Exactly.
This is the fourth pandemic where you provided care. Um, Talk about what you've seen between the two and how they've been managed, or the four and how they've been managed.
Yeah. So, it's interesting. I think that this one certainly, this one is probably the deadliest and probably the scariest of them all, just because this disease moves so fast.
Mm,
With the other pandemics, I felt like people at least had the opportunity to get to the hospital. We're
mhm,
seeing a lot of people here collapsing at home, dying at home,
mm.
which is not something that I've experienced with the other pandemics. So, the progression of the disease itself moves very, very fast. Um, I think the other thing is that, we have to, we have to have some coordinated approach. I'm really glad that I'm seeing some of the states come together, some of the regional states come together, because you really do have to have a regional or national plan to actually attack this. I was driving just recently I work at a hospital up in New Hampshire, driving through New York, Connecticut, Massachusetts, and then into New Hampshire. I see 4 different sets of instructions going up the highway.
Wow.
Right. Right. It's just like, okay, these are states where, people live in Connecticut and work in New York. People,
Yeah.
I live in DC, I work in Virginia. We have to have some coordination
Mhm.
so that, it's kind of more of a unified voice as far as the plan and what we're going to do. And then there should be some things that should be specifically tailored to specific issues that state is dealing with. But some of this we all need to be doing.
Absolutely, absolutely. And it's good to hear you say, not that we have four different sets of instructions, because that's confusing, but
Yeah,
we need to really think along those lines. That's part of that business plan that you're talking about, because you're
absolutely.
bringing back people back into the world, and we all got to survive here. So it's about taking care of each other. Is there anything communities can do, you think, to help?
You mean community organizations?
Yeah, like Rotary, for example.
Yeah, I think that the main thing I find there that I think is really helpful is to actually educate people. I've actually been surprised with my community on the webinars. We've been given the webinars for about 2 to 3 months. So we've probably reached about 300 or 400 people. I think and they call me back and they tell me, oh my gosh, I did this differently. I did that differently, And so I think educating people is the most important thing. And educating them from someone that's in the clinical arena, right? So there's not any sort of, it's an apolitical conversation. It's just about medicine.
Gotcha, gotcha. Well, we're about to close now. So if you have one message you would like to leave with my viewing audience, what would that message be?
I would say, you know what, it is really patriotic to support the common good. And we really have to look at how to actually support the common good in America. We want all Americans to be healthy. And for us to actually get back economically as a country, we're going to need to all sort of make some sacrifices and do the things that we need to do to support the common good of us all.
Thank you, Dr.
Yeah,
Valdo Crotter, or you are affectionately known as Dr. V, for
that's
joining us today. Please know, and I think I've shared this with you earlier, that you're welcome to come back anytime if you have updates that you think our audience would benefit from. We are all over the state of Virginia, so we'd like to be able to ensure, as Rotarians, that's our part, to push out the communication and the message that you've just shared with us today. So I'm excited about that. Okay, so thank you for coming out.
You're welcome. Thank you for having me.
Sure. For the Rotary Times program, I am your host, Rotarian Dr. Debra Jackson from the Rotary Club of McLean, Virginia. You're welcome to join us at any Rotary Club for either a breakfast, lunch, evening, or virtual meeting. To find the club nearest you, just look us up on the District 7610 website. We'd love to have you. We'd love to have you join us. Please know we're also opening our latest communications tool. We will be now seen, so you can follow us again on Facebook and YouTube. So just look us up on the district website and you'll find the addresses for the Facebook and YouTube locations. So remember, our time is your time, and it's always time well spent together. Join us for our next program as we continue to celebrate Rotary's 110 years of service above self in order to do good in the world.